Hi, my name is Jamie Parton, and I'm a nurse practitioner student at Maryville University. Today I will be performing my head-to-toe assessment on my patient. Her name is Ming. Prior to examination, I obtained a set of vitals. I did a height and weight. I also did an eye vision test using the Snellen chart and the near vision using the Rosenbaum chart. Also prior to examination, had the patient empty her bladder and change into a gown. Upon entering the room, I noticed that she had a steady gait with no shuffling or staggering of the feet. And I washed my hands, and we will begin the examination. All right, first with inspection of the head and face, I noticed that the head is upright and still. There's no tremors or tics present. The skin is normal with ethnicity. Her eyes and her ears, her external features are symmetrical. I will go ahead and palpate the skull. Notice that there's no tenderness, depressions, lesions present. The scalp is freely movable. Her hair is evenly distributed. It's smooth and brown in color. And then we'll move on to the face. Once again, inspection was normal. I'm going to palpate your facial bones. Frontal sinuses, any tenderness? And maxillary sinuses, any tenderness? No. Okay, I'm going to assess your temporal mandibular joint. You can open and close, open and close, and move side to side. Good, no popping or clicking. Any pain? No. Okay, that's good too. All right, now we'll move on to your eyes with inspection. I notice the eyebrows, they are equal and extend outward. The eyelashes are present, evenly distributed, and they curve outward from the eye. Eyelids are symmetrical with no drooping or ptosis present. You can close your eyes for me. I'm going to palpate. Good. Go ahead and open your eyes. Look at the conjunctiva, which is pink. Sclera is white. The pupils are round. And the iris is brown. There's no exudate or any foreign bodies. If you can close one more time, I'm going to assess the lacrimal apparatus. All right. No tearing or excessive pain. Good. All right. Now I'm going to do a couple vision tests. I'm going to have you cover your right eye for me. Okay. Tell me when you see my fingers here. No. 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 Good. All right. Now I'm going to assess a couple other tests. We're going to look at your pupillary responses. Go and look straight at my nose for me. Good. Keep looking. Good. There's direct and consensual pupillary responses present. All right. I'm also going to check your facial nerves for me. If you can go ahead and lift your eyes really high, wrinkle your forehead, close your eyes, open them, give me a big smile, stick out your tongue, puff out your cheeks, clench your teeth. Good. That lets me know your facial nerve is intact. I'm also now going to assess your cardinal field of gaze. Keep your head real still and follow my finger. Good. And again. Good. Cardinal gaze is intact. Accommodation is intact. Lets us know that your oculomotor, trochlear, and abducens nerves are also intact there. Good. I'm going to look in your eyes using my ophthalmoscope. And assess for the red reflex. Straight ahead. Good. Reflex is present. Alright. Now I'm going to move on to your ears. Upon inspection, notice that they are symmetrical. The auricles are even with the outer canthus of the eye. I'm going to palpate. Any tenderness? No masses present. Okay, good. I'm going to use my otoscope and we're going to examine the inner ear. Have you kind of lean your head that other way. Touch your shoulder for me. External canal looks good. Tympanic membrane is pearly gray. There's a light reflex. All the other bony prominences are available. There's no redness or perforation. Go and look that other way for me. Sternal canal good. And tympanic membrane once again. Pearly gray, no bulging or perforation. Good. Alright, we're going to do a couple hearing tests now to make sure acoustic nerve is intact. I'm going to have you cover your left ear and whisper and say what I say. Good. Go and cover the other ear for me and repeat what I say. Good. All right. That lets me know that that's intact. I'm going to do a couple more tests. This is the Weber test. Let me know if you hear the sound is equal in both ears, okay? Is it equal? Yes. Good. Now I'm going to do the Rinning test here. This is going to assess for bone and air conduction, okay? Let me know when you stop hearing the sound. This other one. Sorry about that. Took a moment. Okay, good. Air conduction is longer, so that's a normal finding, okay? Before we move on to your nose, I also want to assess your trigeminal nerve for sensation. Go ahead and close your eyes and tell me where you feel the Q-tip. Keep them close for me. Does this feel the same? Yeah. All right, good. You can open your eyes for me. All right. Now we're going to move on to the nose. The nose is midline. Skin is normal. There's no lesions or abnormalities. There's no nasal flaring. If you can close one nostril for me. Breathe in and out. And then do the other. Good. Both nasals are patent. I'm going to use my light look in. The nasal mucosa is pink. Along with the turbinates, those are all present in pink, and the septum is midline. Good. I'm going to go ahead and examine your mouth now. Looks like your lips are pink and normal. No lesions or masses. If you can just open your mouth, I'm just going to take a look. The buccal mucosa is pink and moist. The tongue is pink. Good. Just touch your tongue to the roof of your mouth and side to side. And the other side. Good. The lateral ventral surfaces are normal. That lets me know the hypoglossal is intact. That's your cranial nerve. I'm going to have you tilt your head back and then open up one more time. Soft palate, hard palate, and the oropharynx is also moist and pink. I'm going to assess for your additional cranial reflex. If you can say ah, ah. Touch the gag. Good. Both of them are intact. That lets us know that the glossopharyngeal and the vagus nerve are all intact. I also noted that your teeth are ivory white, permanent teeth in place. The gums are pink, no bleeding, no lesions, or any abnormalities there. So that all looks good. All right, we're going to move on to your neck. Looks like the neck is symmetrical. Muscles are also symmetrical in the neck region. The trachea is midline. Thyroid is not enlarged. There's no jugular venous distension present, which is good. I'm going to assess your carotid. Good. 2+ present on that. Go and tilt your head back. Trachea is midline. Thyroid is present. No nodule. Swallow. Good. All right. Also, I'm going to assess for your lymph nodes. I'm going to do occipital, preauricular, postauricular, tonsillar, submandibular, submental. Anterior cervical, posterior cervical, your deep chain cervical, supraclavicular, infraclavicular. Go and lift your arms up for me here, and we're going to assess your axillary. All right, good. Okay. Going to listen for any bruits to your carotid artery. the bell on my stethoscope. And the thyroid. Also, before we move on, we're going to assess your the range of motion with your neck. We're going to do active and passive. If I can have you touch your chin to your chest, look up at the ceiling, look to your left, look to your right, touch your left ear to your shoulder, and your right ear to your shoulder. Good. Now you can look ahead, go ahead and against my resistance. Same. And shrug. Good. That lets me know the spinal accessory nerves are also intact. Okay. We're going to move on to your extremities. Note that your hands are symmetrical. Hair is evenly distributed. Skin is warm and intact. Muscle mass is even. Nail beds are firm, smooth, and pink with a brisk capillary refill. We're going to check radial pulses. Those are +2. Brachial pulses. +2. Good. Assess your reflex. Just relax your arm for me here. Relax that arm. Good. All right. If I can have you turn around for me real quick, Ming. I'm going to assess your posterior chest. Okay. First, with inspection, I note that the skin is normal with ethnicity. The respiratory rate is even and unlabored. There's no labored breathing to note. Looks like the AP diameter is less than the lateral, which is good. I'm going to then palpate here, see if there's any discomfort. Go ahead and say 99. 99. Again. 99. Again. 99. Good. That was tactile fermentus, which is normal. That's a normal finding. I'm going to assess your thoracic expansion at your 10th rib. Go ahead and breathe in and out real deep. One more time. Good. Your chest is rising equally and like it should. Next, I'm going to percuss your posterior chest for resonance. And assess for CVA tenderness. Any pain? No. Any pain? No. Okay, good. Next, I'm going to do something called diaphragmatic excursion. This is measuring your inhalation and exhalation. What I'm going to have you do is take a deep breath, and when I tell you to, go ahead and hold it. And then I'm going to mark where I hear resonance change to dullness using the mid-scapular line. All right, you ready? Yes. Okay, take a deep breath in and hold it. Go ahead and exhale. Take another couple breaths, and then when you're ready, I'm going to have you take a deep breath in, and then you're going to exhale and hold it. Are you ready? Yes. Okay. Take a breath and exhale and hold it. Good. I'm going to percuss up from that line until I hear resonance again. Good. All right, you can breathe again. I then would measure that line. That's about 3 to 5 centimeters, and that's a normal finding. I then would percuss on the left side for the same evaluation. All right, last I'm going to listen to your breath sounds on the posterior chest. Take some deep breaths. Good. Normal breath sounds. Lungs are clear and vesicular sounds are present. You can go ahead and turn around for me. I'm going to now examine the anterior portion of your chest wound. Maybe pull your gown down. Thank you. Upon inspection, once again, the chest is equal. Respiratory is unlabored. There's no retractions or pulsations present. Skin is normal with ethnicity. I'm going to assess here for palpation. Tenderness? No. Okay, good. We're going to assess the precorum by palpation. Start here with apex, move to the left sternal border, and then the base. Good. No pulsations, anything present. I'm going to assess your apical pulse, the mid-clavicular 5th intercostal. Good. All right, that all sounds good. I'm going to percuss your anterior chest real quick. Once again, sounds of resonance. Have you lift your arms to the side? I'm going to do your lateral chest. Good. You can relax your arms for me. I'm going to listen to your lung sounds. Just breathe normally when I tell you. Let's take some breaths from me. Lift your arms to the side one more time. Listen to your lateral. Okay, you can go ahead and relax. I'm going to listen to your heart sounds here. I'm going to start with the aortic, the pulmonic. This is now moving to the left sternal border. Erb's point, tricuspid, and mitral. Good. S1 and S2 are present. There's no abnormal sounds, S3, S4s. So heart rate is regular. You can go ahead and lay down for me. I'm going to examine your abdomen. First, I'm going to start with inspection. I'm going to note that the abdomen is flat, non-distended. Skin is normal with ethnicity, which is good. Don't see any pulsations, anything abnormal. So I need to grab my stethoscope. Listen to auscultation in all 4 quadrants for bowel sounds. Bruits in your arteries using the bell, aortic, renal, iliac, femoral. Now I'm going to percuss the abdomen, listening for tympany. May hear dullness over an organ. I'm going to use the mid-clavicular line. I'm going to assess for your spleen. Your liver. I'm going to go down. Listen for resonance to change to dullness along with the tympany changing to dullness. Good. Your liver is a normal size. I'm going to look at your spleen, mid-axillary, percuss up. And I'm going to percuss down. Alright, your spleen sounds good too there. Last, I'm going to do a palpation. This is light palpation. Any pain?
No.
Good. Now I'm going to do deep palpation so I can feel your organs, okay? I'm going to assess your liver, the left costal margin. Take a deep breath. Good. Okay, non-palpable, which is normal. I'm going to assess your spleen here. Deep breath. Okay, good. Once again, I don't feel anything. Assess your kidneys. The left side and the right. Good. Assess your aorta too. Good. No abnormalities there. I'm just going to look at your extremities. Looks like the skin is normal with ethnicity. Hair is evenly distributed. Muscle mass is even. Feet are symmetrical. nail beds are pink and firm. Brisk capillary refill. I'm going to assess your popliteal, your pulses, posterior tibial, and then the pedal. Good. All pulses are symmetrical and they're 2+. If you can go ahead and sit up for me. Sling your legs on over. I'm going to assess here your reflexes. Go ahead and relax those legs. Good. Once again. Good. Relax your foot against mine. Your Achilles. Good. Reflexes are present. I'm going to lower you down to me for our last set of tests. Assess your muscle strength. Go ahead and stand up for me. Go ahead and squeeze my hands. Go. Put your arms up like this. Pull in. Push away. Good. I already saw you walk, so you had a steady gait. Go ahead and face that way for me. I'm going to inspect your back. Oh, you can stand straight for a moment. Once again, no spinal deformities. Any pain? No. Good. All right. Go ahead and bend forward for me. I'm going to assess your spine. Curvature is non-lateral, which is good. It's normal. Hips are equal. Good. Go ahead and bend back for me. Okay. Bend to the left, to the right, and twisted your hips. Good. You can go and have a seat. All right. Well, this concludes my head-to-toe exam, and all findings are normal. Thank you.